Welcome to our second virtual chat for Project Enlist Canada. I want to thank our sponsor Galvian for making this possible. Really excited. We've got another good panel here today, starting with Mike Terry. Mike was a Master Corporal, spent 23 years as a veteran with the Canadian Armed Forces. Mike, you want to talk a little bit about what you did when you were with the CAF?
Yeah, Tim. So I was I was in the infantry for 17 years and did any number of just what we call regular infantry combat duties, things like that. I spent 6 years as an imagery technician and public affairs specialist, and I retired in 2018. I was diagnosed with PTSD and a few other disorders in 2001. So I served about 17 years with PTSD.
We also have with us Allison Leamon. Allison, welcome. Allison retired as a Master Corporal in the infantry. Allison, you want to tell us a little bit about your background? And we see you sitting in your police uniform. Maybe you can tell us how you got to where you're at.
Yeah, I was also in the infantry for 17 years, but I was in the primary reserves throughout my career. I deployed to Afghanistan as a machine gunner and a driver. And in during my service with the military, I broke my spine and got a concussion and a number of other injuries, as well as being diagnosed with PTSD later on. And I'm now a police officer with the region of Peel, and I'm the head armorer for all of Peel Police. So I service all of our firearms, and I'm the crime gun analyst. So anytime someone's arrested with a firearm in Peel, I would do that analysis on the firearm and then testify in court as the expert witness on it. So it's really good work. And then we've just recently founded an organization within Peel Police called the Military Internal Support Network, and with that we support any military members within our membership of Peel Police.
Yeah, really cool, and we're going to talk more about peer-to-peer strategies later. We're also fortunate to be joined by Dr. Carmela Tartaglia. Dr. Tartaglia is an associate professor and clinician scientist at the University of Toronto. Dr. Tartaglia, welcome again.
Hi, thank you for inviting me.
And do you want to share with everybody a little bit more about your background?
Sure. I'm a cognitive neurologist, which means that I see patients who have problems with their thinking or their memory or changes in their personality. And so I see patients who have persistent symptoms of concussion, as well as patients who have neurodegenerative diseases, whether it's Alzheimer's disease or possibly chronic traumatic encephalopathy. And I run a research lab trying to find better ways of making diagnosis and, monitoring treatment effects for people who've had concussions or are at risk of neurodegeneration.
So Mike, when we were first introduced, your first comment when you heard a little bit about what we're doing is, well, I didn't have any concussions or head injury during your service. You still feel that way?
Since our introduction, I've started to kind of question that, certainly. I think, my initial discussions were with Ryan Carey, and he kept talking to me about the Concussion Legacy Foundation and Project Enlist, and I'm kind of like, oh, that's great, but I've got PTSD. I've never been diagnosed with a head injury, never been treated for a head injury, so I just kind of, it took a while for me to kind of connect the dots, and now it's like, okay, as I look back on that 23 years, there's definitely a question of how many times did I take a knock to the head, and has that contributed to any of the, essentially psychosocial disorders or concerns that I've been diagnosed with. So yeah, it's certainly raised questions.
Was there any instances that you remember specifically in training where you potentially suffered mild traumatic brain injury?
Certainly, running through the obstacle course. I know I've hit my head off of a few things in the obstacle course before. I definitely took a big hit to the head during my dispatch rider course, crashed the bike, and my head just, pounded right into the sand. And, definitely I can look back on those and other instances and say, you know what, yeah, I remember hitting my head. I remember having a headache, but we just soldier on, you just keep going. So, and you just kind of fight through it. But yeah, I can almost with confidence say, yeah, I suffered a mild brain injury at some point.
And Allison, does that jive with your experience?
Yeah, definitely. Over the course of my time in the military, I've rung my bell on more occasions than I can count. Especially offloading from helicopters with heavy weapons. You don't land right and your mortar swings around and cracks you in the back of the head. Those things happen as infantry soldiers routinely. But then I was definitely diagnosed with one when I had the injury with my spine. I was taken to hospital and admitted to hospital with a pretty bad head injury and neck and back injury. So one diagnosed and then numerous knocks to the head.
Dr. Tartaglia, do you deal with that with some of the patients that you see? Reaction, well, I haven't really had any head injury. I've never had a concussion. I've never been knocked out. And maybe just talk about some of the symptoms for those that are questioning whether or not they have it in their history.
Yeah, no, that's a great question. And it often happens that, people do hit their heads and, or sometimes, you don't need to hit your head to have a concussion. Another part of your body can also be hit, and the force transferred or transmitted to your head can give you concussion symptoms. And it's difficult to recognize. And, I always say to people, it's not a very useful thing to ask the person who's had their head hit whether they're okay, because sometimes their insight, their self-awareness is actually not very good at that time. And so they don't recognize that they've had a brain injury. And although it's mild, it's still a brain injury. And so part of, this I guess, increased awareness is really to have people recognize symptoms. So when a person has a headache, when a person has dizziness, when a person has, some confusion, or they don't remember all the details around the events, or they become very emotional. All those things are related to the brain. So they are because you've had a brain injury. And I think it's really important for people to recognize that, but also for people around them to recognize that any change in this person is likely related to a brain injury.
Maybe Dr. Tartaglia, can you talk a little bit about the risk factor for chronic traumatic encephalopathy? Do you need to have had concussions to be diagnosed with CTE?
Yeah, so right now, I think the most important thing to note is that we don't have a diagnosis of CTE, and we actually don't want people to be giving that diagnosis to people unless we make headway in being able to make an accurate diagnosis, because it does carry consequences. The issue is that right now, the biggest risk factor for CTE are concussions. We don't have cases where people have not had concussions. And so, this is like lung cancer and smoking. Not everybody who smokes gets lung cancer, but there is a type of lung cancer where the biggest risk factor is smoking. And so, although the relationship is not one-to-one, doesn't mean you get a concussion that you get CTE, doesn't mean even that you get multiple concussions and you get CTE. We have a brain donation program, and there are people who, have had many concussions because of because they were an athlete or because of the work that they did, and they have no CTE in the brain. But still, the number one risk factor is repeated concussions for the risk factor for CTE.
Mike, you've got a bit of an interesting background. The majority of service people do have athletic backgrounds, but you did not play any sports, right? As far as I understand.
No, I wasn't a big team sport player. Played a lot of paintball. That was, which obviously translated later in life. But no, so never anything that would have come from any contact sports or anything like that.
And then maybe talk a bit, Mike, about how your symptoms associated with your PTSD started developing, what that period was like, and then, maybe share for others that are watching the video that are dealing with similar things, how you were able to get ahead of it.
Well, it really started in 2001 after I returned from Africa. I'd been deployed to Ethiopia and Eritrea, and just started to notice a lot of anger and aggression, a couple episodes of rage, and just generally unpleasant. And it was actually through marriage counseling. I had said something to this marriage counselor who kind of, said, well, pump the brakes. That's outside of the norm. And I was basically referred for assessment. And that's when I got diagnosed with PTSD. Now we're talking 20 years ago. I got to be honest, it's a little foggy. I just remember life being really, really unpleasant. Sadly, in my case, as is the case with a lot of people at that time, I went on to actively, manage it, but managing it was basically at the expense of minimizing it, hiding it, and really putting up that front that I was okay. So in terms of getting on top of the symptoms, it wasn't until I retired and I actually was able to admit that I'm not okay is when I actually started to see progress in terms of resolving a lot of the issues and, addressing a lot of the behaviors that came from it and a lot of the struggles that I had. So, that initial period is a little, it's muted by time and it's muted by minimization for sure.
Allison, does that jive with your experience? Did you have any mental health challenges coming out of your accident and the head trauma that you sustained during your service?
I've had a lot of feeling like I couldn't do a lot of the things that I used to be able to do, which really made me feel like I didn't want to pursue anything new because I just felt like I couldn't do anything. I had a hard time accepting sort of my new standard or my new abilities or lack of ability. I really got really depressed that I just wasn't who I thought I was anymore, and who I identified as before, when I was able to do different things, when I was able to form the things that I wanted to say, when I was able to do even the physical things that I wanted to do. So I had a really, really hard time accepting that part was gone, and then actually taking the steps to get some therapy going, and really just finding something new that I could put my efforts towards.
So Dr. Tartaglia, when you run into patients with military service backgrounds and you hear them talking about some of the symptoms that Mike and that Allison are talking about, from a brain injury standpoint, what are your recommendations?
Yeah, so we use a very targeted approach. Everybody's got their own personal history, and we always say the concussion happens on a landscape, and you are that landscape. You have your whole history. Some people have had concussions from other things because they played sports. Some people have, headache from, a young age. Some people have mental health issues. So we always treat the person. And so we try to understand all the risk factors for them having persistent symptoms, and then really target each of the symptoms. If somebody's had a concussion and is still struggling with post-traumatic headache, we try to address that, because obviously if you have a headache all the time, you aren't going to be able to concentrate as well. Your memory is not going to be great. You might be more irritable. You can't sleep, and it becomes a vicious cycle. Those things can make people depressed, can make people anxious. If you're dealing with dizziness, we can assess the source of that dizziness. Is it vertigo? Is there something else going on? If you have sleep issues, and then, getting into the mental health, is it anxiety that a person has after their concussion? Is it post-traumatic stress disorder because of the context in which the concussion happened? Is it depression? And, and then is it, are they complaining about memory issues? concentration, language problems, and then really trying to target each of those symptoms individually, irrespective of the cause. We do brain imaging to make sure that there's no other issues at hand, but then really targeting each of the symptoms individually.
Allison, what helped you get better?
Well, in this last year, I had another concussion last March. And this last year, I've been attending a physiotherapy clinic called Shift Concussion Management, and they've been instrumental in helping me improve with some of my lingering symptoms. I do regular visual therapy there, as well as manual therapy there for my whiplash as well, because I know whiplash leads to a lot of the symptoms appear the same as concussion symptoms. So them working on my neck has really been helpful. And the visual therapy is mostly vestibular, and that seems to be where I have lingering effects. So that's been very helpful as well. And my clinic referred me to a eye doctor who specializes in concussions, and he did a very long exam, and I ended up with these fancy blue lensed glasses that are supposed to help with my concussion as well.
Mike, same question for you. What helped you get better?
Well, I think the difference with, between Allison's experience and mine, my entire treatment regimen ever since I was diagnosed has all been psychosocial. There's not really been anything to explore anything physiological. So, I can talk about PTSD and I can talk about, major depressive disorder, and really what's helped in that regard is just being very honest with myself. And Allison had mentioned, I don't identify as that person I was. I can't do the things I did anymore. I definitely experienced that when I left the infantry and became an imagery technician. I really struggled with this loss of identity, and I struggled with it again when I retired. And coming to terms with accepting that that's not my identity anymore, and then honestly just a ton of work on the psychosocial side, self-assessing all the time, really working at it all the time is what's helped me to see gains. But as we've been talking, and as I've, since our introduction a few months ago, I guess it opens up the question of, what can I be looking at on the physical medicine side of things or the concussion side of things to maybe augment that treatment plan, or that I might actually respond really well to if I do in fact have any sort of minor brain injury that's contributed to these problems. Again, I'm at that stage where that hasn't even been explored.
So perfect question for you, Dr. Tartaglia. Just fortunately, we have one of the top specialists in the country. So Dr. Tartaglia, for somebody like Mike, where all this happened quite a bit of time ago, what would you recommend?
Yeah, no, I think, as you said, you worked on the symptoms that, were really, I think, important for you. And that's actually the most important thing, is that each of us is very different, and we really have to heal in the way that makes sense for us. And so, if it was cognitive behavioral therapy, psychotherapy, whatever it was, but then if there's other things that you're still complaining about, that you think, well, I feel like this is different, then I can't do this in the same way, then I think we ask, the questions. And honestly, right now we have no markers to say that somebody has concussion or has the lingering effects. And so it's really a clinical interview that you have to do. And I'm assuming that's what Mike did to get to the help that he got. But it would be the same way that we would treat that. So when patients come, they just get an extensive, 2-hour interview, some neuropsych testing to see what it is that isn't quite right and how can we address it.
So maybe talk about that a little bit more, Dr. Tartaglia. Is, these injuries and these symptomologies are very complicated. It's often, it seems like it's not just one thing. And, to try and draw a straight line between, brain injury and concussion and CTE and, mental health challenges like anxiety, depression, and suicide is difficult because there's so many contributing factors. How do we make sense of all of this? What part of it is psychological and what part of it is physical when people are dealing with these challenges, knowing that every injury is different?
Yeah, no, I think that's a great question, but you have to remember that all the psychological comes from the brain. It's always physical, right? There's a brain, and your brain can change on a structural level, right? So people can have a major injury where they actually, take out pieces of their brain, right? There's brain cells that die, but you can change connections of the brain. You can change the neurotransmitters of the brain, and those are invisible injuries. And invisible injuries are unfortunately difficult to detect, right? And so it's hard to draw a straight line, but no matter what, you can draw dotted lines, right? People do have a moment in time. When you have a brain injury, most of us have a moment in time where the injury happened, and some of the symptoms come on afterwards. And a lot of times those symptoms, some of them recover, right? Or at least the first time you have the injury, they recover. And the second time, maybe it takes a little longer. And the third time, even longer. But they're insidious in some cases. And so it's very difficult for us to detect. And honestly, we cannot circumvent just good clinical care, just spending the time to get a person's history and to see, what factors are contributing to the persistence of symptoms. We know that women seem to be at higher risk of having a concussion, having more persistent symptoms. So using that kind of information to help us, create prevention strategies, detection strategies, treatment strategies. We have to treat people, right? So medicine has been really good at kind of lumping people together, but each of us has our own personal story. And really at this moment in time, without good clinical care, it's very difficult to make headway in this. And I think really in our field, we're really going to have to work towards finding biomarkers to be able to say, yes, this brain injury has led to a concussion in you, and we're going to try these treatments, and we're going to monitor the effect of those treatments on you and see how you recover. Because I think the most important thing is to see when you have recovered, right? Because a lot of us, it's hard for us to know. Sometimes I have patients, they get to a new level of functioning and they have to accept that. But not all the interventions have been tried yet. And I think that's all around for brain injury, right? A lot of cases, it's an invisible injury.
Yeah, Allison, what would be your advice for CAF members, veterans, first responders that are dealing with some of the issues that you've dealt with? Having been through it yourself, what's your advice to those that are struggling with those issues today?
I would say the largest thing is to really advocate for yourself. No one is going to necessarily recognize any of those things in you and push you to get any help. So really advocating for yourself and looking out and seeing what you can find for available clinics or somewhere, or even just talking to your family doctor about what some of your symptoms are, what you're experiencing, so that way you can get that help. Knowing from my first concussion to when I had my last concussion, just the first time it was somebody wake her up every couple of hours, and that was it. There was no follow-up, no treatment, no therapy, nothing. And I also didn't know to advocate for myself. I didn't know that there were things out there. So really just having the information out there, I think, is extremely valuable. And then having people just have the courage or the wherewithal to advocate for themselves to get that treatment.
Yeah, I really appreciate that comment. Absolutely agree. And if the Concussion Legacy Foundation can be helpful, you go to projectenlist.ca or concussionfoundation.ca and look up our helpline. It's a free service, and we look to help you navigate services in Canada and pair you with the best available services that are in your geographic area. So, Allison, appreciate your comment on that. Mike, has this changed the way that you've been talking to some of your existing therapists and what have been their reaction?
We haven't really crossed that bridge yet in terms of discussing the physiological side of things, but it's definitely something that I'll be looking to follow shortly. I think one thing I wanted to mention while Allison was speaking, she was diagnosed with a concussion, as I understand. There's that very clear marker of, this, or at least in one case, that this was the injury. When I look back, there's no documentation at all on any of the times that I sustained any sort of head injury or blow to the head. And I think Canadian Forces members, we've heard over and over, if anything happens, put it on a CF98. And a CF98 is the injury reporting form. And we always get told that. And you always go, yeah, I'm invincible, I'm going to live forever. And you just don't really bother to do it until you retire. And then all of a sudden you're like, well, when did this happen? And the dates, times, all those things. For me, looking back for head injuries, I wish I had kept a journal saying, on this day riding the dispatch bike, I thundered in and hit my head. On this day, I was on the anti-tank range, as a range safety staff for 4 hours while people were firing this weapon with this massive concussion that comes from it. I wish I had recorded those things and had that sort of data, even if it was just in a journal, to kind of be able to go back to. And I think, in terms of like CF98 and injury reporting, the other thing is, unless there's an injury that kind of stops you where you are, you almost don't even consider it, because you just keep going. So it's not like, oh, I hit my head, I had a headache afterwards, I'm going to put a CF98 in there. It's like, well, I didn't have to go see the doc. I didn't have to, I didn't have to be relieved of my duties for whatever it was I was doing. So we think, oh, it doesn't matter, I'll just carry on. But I think actually just even my own personal recording of any time that, I hit my head or got my bell rung pugil fighting or close quarter combat training would be a huge asset right now.
Yeah, no, very, very good comment. And Dr. Tartaglia, back to you. And, we hear all the time that head injury and brain injury and concussion are not necessarily focused on in med school, and that some physicians get no training, some get very little. Pair that with the fact that treatment strategies and our understanding of the way to treat these injuries have evolved so fast, even in the last 5 years. Very difficult that the system has not caught up with what we know about head injury. So what would you advise to veterans and to CAF members, that suspect that it may be part of the equation of some of the difficulties that they're going through? What would you advise them to do, knowing the system is not really equipped to handle this right now?
Yeah, well, I think that's a great point. And I think, like Allison said, you really have to advocate for yourself, and I think for each other. I always say, you might not recognize it in yourself, but I think, people who've experienced it will recognize in other people that something has happened. And so you could be the best advocates even for those around you that may have sustained an invisible injury that is unrecognized by themselves. I mean, Mike, probably these occurred at a time when people didn't even pay attention to them at all. And that's one of the problems with the medical schools, is that concussion wasn't recognized as a true brain injury until relatively recently. Some of the medical schools across Canada actually have now introduced, as part of their curriculum, brain injury. And I teach the residents here at University of Toronto every year on brain injury. So at least the neurology residents, I've actually recently been asked to teach the psychiatry residents about that. And so there is an increased recognition that this happens, that there can be long-term consequences. Concussion now made it to the list of modifiable risk factors of dementia in July 2020. So I think we're all moving in the right direction. But I do think somebody who's gone through it can be the best advocate for themselves as well as for those around them for what can happen after concussion. Some of the symptoms are readily treatable, and unfortunately, people are living with them for years, and they don't need to.
Dr. Tartaglia, talk about the role of the physician. And, we've always been told a multidisciplinary approach to treatment is the most effective treatment. Can you talk a little bit more about specifically what that means and what kind of other disciplines you would want to involve in a really comprehensive multidisciplinary strategy?
Yeah, no, that's great point. So, when you think of people having a concussion and you think of the multitude of different symptoms, we looked at that and there could be up to 50 different symptoms that people have after concussion. So for a multidisciplinary point of view, what we have is we need neurologists or neurosurgeons or somebody who's actually a physician who makes sure that it's a concussion and not something else. So you do need a medical person. A nurse practitioner could do it too, but somebody who makes sure there's no other injury that has gone on. Once you've done that, then you really have to do an inventory of all the symptoms, right? And depending on the symptoms, you need to target them. So if it's physiotherapy that you need, usually a good physiotherapist is essential in a multidisciplinary clinic. Occupational therapy, a lot of times people will complain about cognitive issues. Sometimes you need headache specialists if you don't have a neurologist who's able to treat the headache. Sleep disorders are not uncommon after a head injury. So, some of the times we need to enlist our sleep clinic physicians. Neuro-ophthalmology, we often send our patients to ophthalmologists to get a good assessment of the eyes. So to see and make sure that there's not been any convergence problems. Psychiatry, we have, in some cases, we're very fortunate, we have great psychiatrists. Social worker to help people navigate all the resources that are required for people dealing with, whether it's workmen's compensation or even just navigating any system to get some financial resources. Nurse to help with medications that we prescribe, follow up on that. I think those are the essential ones. And then, I'm sure there's others that I've forgotten there, but I would say multidisciplinary clinic, you want to at least be part of the network. The Ontario government commissioned a group of us to create health quality standards dealing with concussion. And part of those standards would include that you can't declare yourself a concussion expert unless you are part of a network where you could actually access different types of resources for your patients.
So Mike, in terms of your experience having, dealt with specialists, dealt with, different forms of treatment, how challenging is that going to be for your average veteran out there to go out and try and navigate a system, which again is somewhat ill-equipped to deal with this injury? Do you have any advice in practical terms for those guys? Like, as you're sitting there with your psychiatrist or your psychologist or whatever, what would be the words that you would use to talk about this?
Well, I'm very lucky that I have a psychologist that I have an incredible working relationship with. And I think that, and that comes back to Allison's point about advocating for yourself. If you have a service provider who you don't feel is going to have your best interests in mind when you start bringing these things up, I think the best thing, you need to find that service provider. You need to find that high functioning, relationship with that clinician. And from there, I have full confidence that as I bring this forward to my psychologist, it will be, it'll be addressed in the appropriate way. It'll be given the concern that, the same concern that I give it. So it really comes down to that advocacy. And I think, that's true of people who are serving as well. A lot of times we don't have a lot of choice because you have military provided clinicians or practitioners, and you don't have that choice all the time to say this relationship isn't working, or you'll get a lot of pushback when you say that relationship isn't working. You've really got to advocate for yourself to get, like, your healthcare team needs to be in your corner, and you need to feel that you're able to trust them and open up to them about all the issues you're facing. So that's, advocating for yourself to have those types of relationships is the best advice I could give.
Yeah, also think about Dr. Tartaglia's point earlier about, asking somebody who's neurologically impaired, to try and go and navigate their own health is very challenging. So, if there's any caregivers that are watching this, also really important if you can get the caregivers involved. And again, we do have networks and support networks for caregivers as well. Allison, have you had any success in terms of leaning on some peers for support? Has there been any of that that's helped in terms of your recovery?
Actually, the guy who you saw milling around the background earlier as my partner at work, and he was off work at home for 17 months with concussion. And he's the one who got me in touch with the shift concussion management. And he's been a large part of who I lean on and talk to about symptoms and just advice and sharing experiences with. And that's been instrumental in not feeling alone, even though that this is a massive thing that many people deal with. It is definitely something that when you go through it, it's very easy to feel alone in it. So having someone to lean on is most definitely helpful. And talking about it as with PTSD and with head injuries and your residual effects, I would say trying to break that stigma and talking about it and getting your story out there does help to help you feel less alone.
Mike, what's your experience with peer support?
Well, my experience with peer support is actually, it's funny. I'm more of a giver than a receiver. And I think there's a lot of us who are like that. It's easy to give advice. It's harder to take it. I've definitely got a good network of peers, and I do work in peer support. I think for myself, when I am struggling, it is far harder to reach out and ask for help than it is to reach out and offer help when you can. Honestly, that's been one of the hardest things for me is, and again, Allison hit the nail on the head saying, you're in a large community of people who experience this, but you feel very alone. And even with working with peer support, talking to peers, and they've said, yeah, I wanted to call you, but I don't want to bother you, and that's, I think, yeah, the most important thing with peer support is actually reaching out for it when you need it. And it's the hardest thing to do. But once you start reaching out, I know once I started to share my story and to speak publicly about the struggles that I have, it is very empowering. And what you hear back from other people and what you see reflected back to you is not only reassuring for them that they're not alone, but it's reassuring for you. So yeah, that's my biggest thing is just speak out, whether it's publicly, whether it's in private to peers. As we speak truth to power, both in terms of PTSD or, traumatic brain injury and concussion, because they are those stigmas are so similar. I'm alone. It's an invisible injury. People ask you when you're going to get over it. And those are the things that make you kind of want to withdraw and not reach out. So yeah, as far as peer support, I don't know if I've danced around your question or not. The biggest thing is to engage with somebody. And I've found even when I'm struggling, when I engage outward, and maybe I'm not asking for help, but when I start to talk to other people, I gain insights into what's going on with me. It lets me know I'm not alone. It lets that person know they're not alone. So it's just, it's good going both ways.
And you're wearing a Dispatches t-shirt.
Yes, I am.
Can you talk a little bit about what Dispatches is and how that's helped?
So Dispatches is it's an adventure motorcycle ride where I basically tour around Canada and I'd share my story. And it started probably about 2 months after I retired. Essentially, I retired, I suffered with that loss of identity. All those psychosocial issues just kind of came crashing in on me. And it really came out of desperation. I had to do something. I had to find a purpose. So I decided to buy a bike, tour around Canada, and just talk to anybody who wanted to talk about mental health issues and post-traumatic stress disorder. So we're now 4 years in, and big plans as soon as COVID allows us to travel again. yeah, to basically go out and engage with, service clubs, practitioners, basically anybody who has any stake in talking about mental health disorders or concussion and traumatic brain injury, and talking about those stigmas and just breaking the silence.
Yeah, we're thrilled to support you at Concussion Legacy Foundation Canada, to support you in your ride, and we're excited to see, as you tour around the country and talk to CAF members and veterans about, some of the issues that Dr. Tartaglia has been good enough to share with us today. We're looking forward to continue to share this knowledge and continue to develop our working knowledge, both for veterans and CAF members, but also for the providers that are servicing them. At the end of the day, there's a real community, and in Canada in general, I think, we all care about our service people and our veterans, and we all want the same thing. We want to see, you guys being healthy and happy, and having the country support you. Just to close up, Dr. Tartaglia, I mean, sometimes difficult to access a number of the different therapists that you've talked about, particularly depending on where you're living geographically. It seems like if you're in a major urban center, there's certainly much more resources available, more difficult if you're in rural communities. Maybe talk a little bit. I mean, one of the things, the feedback that we've got is through these peer support networks that are happening formally and informally within the veteran community. We've heard feedback that a real focus on diet, exercise, and sleep has been helpful for people suffering with symptoms. Can you comment on that, on the role of sleep, diet, and exercise in terms of recovering from brain injury and the effect on mental health?
Yeah, and those are great points. And I think, diet, exercise, and sleep are important for all brain function. And so it's not surprising that would be important in mental health after a concussion. It's important in many brain disorders. I think in terms of what I was hearing about the peer support, I think it's really important. And, the one thing that COVID has done that may be more on the positive side is it actually has brought a lot of people together in a virtual way. And so, we had to go from one day where all our visits were in person to 100% virtual visits. So it is now much easier to access help across the province and across Canada. So, I think the most important thing is to find the local person, your clinician, and advocate for yourself. But in terms of having access, the issue is our healthcare system doesn't necessarily cover things like occupational therapy and physiotherapy unless you have some private insurance or a workers' insurance. But those people are now giving virtual sessions in many places all across the country. And so it has become quite a bit easier to access expertise, even if you live in a more rural setting or a more isolated setting. And I think that even post-COVID, this will remain. I used to see patients virtually even before COVID, but it was less than 10% of my practice. And going forward, it will definitely be way more than 10%. And I think that's going to be true across the board. So I do think advocating for yourself to access care is really going to be important.
So lots to be hopeful about. Hopeful in terms of healthcare providers continuing to get more and more educated as the research on this accelerates. Hopeful to continue to build out those peer support networks and to be able to emphasize the importance of sleep, diet, and exercise. Want to thank you, Mike, Allison, Dr. Tartaglia, for your time. Want to thank again our sponsor, Galvian, that's made these chats possible. And if you're interested in getting more information, can be found at concussionfoundation.ca, which is our website for Concussion Legacy Foundation Canada. Or if you're interested in pledging to donate your brain to accelerate the research and to help us move things forward, please go to projectenlist.ca. Mike, Allison, Dr. Tartaglia, thank you.